Hi, this is Eugene from 5 Minute Economics, and today we are going to be talking about healthcare system in US, UK, and Singapore. So we're going to compare these three different distinct types of healthcare system. We're going to see who is better. I think you should have a sensing of where I'm leaning towards based on my nationality. Right, firstly, we are going to look at the UK healthcare system, and the keyword here hinges on free. The UK healthcare system is free. Is free a good idea? So free is actually, there both its pros and cons. We should examine both sides before we come to a conclusion. Now, why is it that the idea of free healthcare is so seductive? It is so seductive because it helps the low income group gets access to free healthcare. And this is something that every society should have. The low income groups should have access to free healthcare. So by ensuring that healthcare is free, no one is restricted access to basic healthcare, which is important. And with that will also improve the non-material standard of living in the country because your healthcare indicators like life expectancy, infant mortality will significantly be reduced. There's a reason why free healthcare seems to be a good idea. Seems to be a good idea because actually I think it's a bad idea. Why is free healthcare a bad idea? Plenty of things we can talk about. Number one, healthcare is actually a significant drain on a country's budget, right? And if your country is already having a significant budget deficit, having free healthcare actually puts further burden on the government's budget, which can actually cause a huge debt to be accumulated over time. Two, let's talk about this issue called moral hazard, which we're going to come back and explore this issue again later when we talk about US healthcare system. Now, what is moral hazard? Moral hazard is when you have something that is free. If you have something that is free, you tend to pay very little consideration in your use of it because you pay zero for it, you pay absolutely nothing for it. So you have little consideration for your health. Your mindset will be like, oh, if I fall sick, the government is going to take care of me, so I can just binge eat, I can eat whatever I want, I can do whatever I want. If I fall down, I have an accident, anything happens to me, I'm covered by the government. There is little need to take care of your own health. Three, now if you have to provide healthcare to the entire population, the demand of healthcare actually is significantly increasing. You need an increase in supply to match the increase in demand for healthcare. Now, when there is so much demand for healthcare, you need more hospitals, you need more doctors, you need more nurses, and when you have more of things, you're going to find that quality is going to become very stretched. Why is quality going to become very stretched? Because your doctors, your nurses in such a healthcare system whereby they're constantly facing an overpopulation of patients, they're going to be working crazy hours, 15 hours, 16 hours, and this is going to actually compromise on the quality of healthcare. And lastly, if you have so much demand for healthcare and you have limited resources, then the only way to ration these resources is by time. I think people in the UK, when they actually obtain healthcare services, they're going to pretty much have to wait a very long waiting time to actually get healthcare. And I guess this is okay for your chronic ailments, but for people who are already in pain, who are suffering, this waiting can add and prolong their torture. Right, so in these specific circumstances, I feel that in the case of UK, free healthcare is actually not that great an idea. Now let's look at Singapore and why we should not move on to a free healthcare system. The first thing we should look at is that we are facing an aging population. Facing an aging population meaning to say that our healthcare expenditure is going to be ever rising. This is going to impose significant burden on our budget. Two, if our healthcare outcomes are already great, you can go and compare our healthcare outcomes like life expectancy, infant mortality rate, and you will find that these healthcare outcomes are comparable to most developed countries, and sometimes we are even ranked the best healthcare system in the world. So if what we are doing is working, why fix what isn't broken? And lastly, if our concern about providing free healthcare is to ensure that lower income groups have access to free healthcare, then let's just try to move our efforts towards making sure that everyone in Singapore who needs healthcare actually gets it, regardless of their income levels. Now, next, let's look at the US healthcare system. US healthcare system, you can see a great distinct difference between US and UK, and they are on the opposite end of the spectrum. 67.3% of the US population depends on private healthcare, and most of this private healthcare is based on an insurance scheme. So typically, employers will pay for their employees' healthcare insurance as part of the compensation package. And the problem here with an insurance-paid healthcare system is the problem of moral hazard. Now, so let's say, for example, if I as an individual, I go and see a doctor, I have some issues. The first problem is I don't pay because I'm covered by healthcare insurance. Now, what happens when you don't pay? Number one, you don't quite care how many diagnostic tests you're going to take. Number two, you don't quite care how expensive your medical medication is going to take. Number 3, you don't quite care how long you're going to stay in the hospital, because all these are not borne by you. And healthcare providers, they have an incentive to actually mark up, because they know you don't care. They know that you have insurance covering you and you don't care. So they mark up this cost, and in the end, who pays for this? The insurance companies pay for this. When the insurance companies pay for this, then your healthcare costs go up, because this cost of this healthcare insurance go up. Now, this is a classic problem of moral hazard, and this is the reason why healthcare in the US is bloody expensive, because there is an artificially created demand and the prices are being pushed up because of moral hazard. And so actually, if you look at US actually do better if they emulate Singapore's version of healthcare, where the public sector takes a large responsibility towards the provision of healthcare. Because if the public sector is the one that actually provides healthcare, it will be the one single biggest player in the market, and it will end up having bargaining power in terms of healthcare services, the prices of healthcare services, in terms of pharmaceuticals. It will be able to negotiate for lower prices and provide cheaper healthcare to US citizens. The elderly, they are covered by Medicare, and the low-income groups are provided for by Medicaid. And this is very similar to the 3M system that we have in Singapore. But this applies only to these two groups of people. And because it only applies to these two groups of people, the rest of the population who cannot afford healthcare, they're pretty much left at the mercy of the free market. Now, here's a question for you. How can Singapore improve its healthcare system, given that we are really doing well right now? And that's it for this week's episode of 5 Minute Economics. We'll catch you on the next one.